There are growing flu concerns for children, especially in the South, where some states have seen a surge of cases. Sam Brock has more on what parents need to know.
With respiratory illness on the rise after the winter holidays, pockets of the U.S. are also seeing troubling trends for influenza.
The cases are not only going up, but increasing exponentially.
Dr. David Jans, the head of critical care at University Medical Center New Orleans, says Louisiana went from seeing a few dozen hospitalized patients with the flu each week to about 300.
Are you surprised by the prevalence of influenza specifically?
It is a lot more influenza than we've seen in a long time, and perhaps even rates as high as we saw back during the 2009 H1N1 influenza pandemic.
The CDC shows a stretch of states from Louisiana to the Carolinas in the very high category of infection, though the national picture is normal for now.
Week over week, I don't see this being a worse season than we had last year.
Just a little poke here.
The CDC says this year's flu vaccine is effective against the prevalent strain, but warns inoculations are down. Many states in the South aren't even reaching a 40% vaccination rate for adults, while nationally it's around 50%.
We see a lot of kids presenting to the emergency room with influenza-like illnesses, approaching the above 30 to 40% of ER visits in children are for that reason, which is a big number.
A trifecta of illnesses, COVID, flu, and RSV, weighing on parents like Keone, whose son Kingston has been in the ICU for almost 2 months.
I really almost lost my child. He was intubated 3 times. He had to have a trach and a G-tube put in because he could no longer breathe.
Physicians warn the critical symptoms to look out for: wheezing and prolonged fever. To see a doctor. Lester?
Coming up on NBC 10.